As the Wuhan coronavirus spreads in China, the Austin ISD announced it's starting to screen students here for that disease. The district says it made the call out of an abundance of caution. KXAN's Tom Miller explains what school nurses are now looking for.
With close to 81,000 students spread out over 130 campuses, Austin ISD says it can't afford to take any risks when it comes to students getting sick, including with the Wuhan coronavirus. Pediatrician Brian Temple says the precaution is a good one, as there's still a lot of unanswered questions about the virus.
Because it is a hub for viruses, for bacteria, and we are using sort of community space. We're touching the same things, we're borrowing pencils.
Specifically, the screening is looking for one of two things, either signs of a fever or a student or staff member who's been to China in the last 14 days. From there, the district will work to determine whether the person in question has come into contact with anyone who may have had the coronavirus in the last 14 days.
I think it's a good idea. I think we should all be safe and cautious.
While students we talk with like the extra prudence.
It's contagious and I don't want people to get sick.
Parents told us they believe the screening is unnecessary.
I think that is overkill and might cause more fear than it helps to reduce fear.
We don't have any cases in Austin, not that I've heard.
With no confirmed cases in Texas, the Centers for Disease Control says the risk to Americans is low. Even so, Austin ISD is trying to eliminate all risk and keep its students and staff safe in the process. In Austin, Tom Miller, KXAN News.
The way to stop the spread of the coronavirus is similar to how to stop the flu. The CDC recommends washing your hands often with soap and water for at least 20 seconds. And avoid touching your eyes, nose, and mouth with unwashed hands. Stay away from people who are sick and stay home if you are sick. The Austin ISD has also expanded the health services they offer. Students can now get tested for the flu and strep throat on campus. It's part of a new program that offers telemedicine at school. Pediatricians will use video chat to diagnose, test, and treat students. They'll even send a prescription to a pharmacy if needed. But parents must sign up for their child to receive these services, and it will be billed to the student's insurance.